Welcome to this episode. It's time with the gynae. So, I want to address an issue. Even today, I was asked in the hospital by one of my clients. She's pregnant, she's about 30 weeks, and she has fibroids. So, the question she asked me was that, Doc, can I have a C-section and then removal of my fibroids concurrently together? And this is a question that you hear a lot. Is it advisable? What are the pros? What are the cons? Great. So that's the question I'm addressing today. We call it Caesarean myomectomy. It's where the baby is removed and then the fibroids are also removed concurrently. That is like a 2-in-1 surgery. And what are the benefits? What are the disadvantages? So yes, I want to start with the advantages. I mean, obviously, the biggest advantage is that instead of undergoing 2 surgeries, we are doing a 2-in-1 surgery for you. So you benefit from having to undergo surgery once for 2 indications. And that's the biggest advantage. It means that you don't have to come again for another surgery for the removal of the fibroid. So that's a huge advantage for you, right? Okay. Now, the other advantage is that you get your baby delivered by cesarean delivery. Yeah, that's fair, right? The disadvantages which I want to address are that, per minute, for a woman who is pregnant, the uterus or the womb, at full term, when I say full term, I mean when you are about 9 months, about 500 milliliters of blood goes into your womb every minute, right? So it means that the risk of bleeding during a surgery for cesarean delivery and myomectomy, the risk of bleeding is high. So that's one thing that you have to take note of. Nonetheless, any doctor who decides to do a cesarean myomectomy, that is delivering your baby by cesarean section and removing your fibroids, knows this risk. So the person will prepare adequately for any risk like that, right? So when a doctor makes a final decision that they want to, maybe you request for it and they agree to do it, I know that for any doctor, they will put in these preparations to get ready for bleeding and put in measures that will mitigate these risks, right? So the bleeding is the main disadvantage. All right, so it's very important to take note of that. Now, there are routine cases where you would have to do a removal of the fibroid. You may have to remove the fibroids. One of them is when the fibroid is at the location where you are going to cut on the uterus or on the womb to remove the baby. The fibroid is in your way. You will not have any way to access the baby or to deliver the baby than to remove the fibroid. So that's very important. Take note of that. The other thing is that if your fibroids are a few, that one, the doctor may decide to remove the fibroids for you. But then again, I want to also say that any doctor who decides to remove your fibroids for you at cesarean session knows the risk that you can bleed a lot. So they put in measures that will make sure that you don't bleed so much. Nonetheless, it is not a routine surgery that is done. It is not a routine surgery. Most of the doctors will advise that because of the risk of bleeding, and the other thing is that when your womb has expanded or stretched so much, carrying the pregnancy to that point, it is difficult at times for your womb to contract when the baby has been delivered. So a womb that is already difficult to contract, if you are going to make some cuts on the womb, it is going to make the situation worse, right? So that is one of the main reasons why a lot of doctors will not advise that you do a cesarean myomectomy. But it is a safe procedure if it's in the right hands. If it's in the right and experienced hands, it's a safe procedure where your fibroids can be removed and your baby can also be removed or delivered at the same time, and you get a 2-in-1 surgery. But it's not something that some doctors will want to do. But I want to encourage you and assure you that any doctor who decides to do that surgery, you have the opportunity to ask questions to know the pros and the cons, the benefits, the risk, and all that. And I'm sure the doctor will be ready to explain to you so that at the end of the day, you are satisfied and you are calm for the surgery. But cesarean myomectomy is something that is done. I want to say that it is not also a routine procedure. not every case, we deal with it on case by case basis. So if your doctor decides that for you, I won't want to risk it and then do a myomectomy and cesarean session together, please understand and accept. Later on, you can still come for the fibroids to be removed. And the good thing is that I have told you in the other episode that it is not every fibroid that requires a surgery. So maybe if your fibroid is there, you've been able to use it to carry a pregnancy till the end. I'm not sure your fibroid really requires a surgery. And one thing is that with fibroids, when they are taken out, different ones can also come. All right. So if your doctor makes the decision that he doesn't want to undergo this, do the surgery for you, please accept and get your baby out, and then later on you can come and then get a fibroid. So this is the bit about fibroid surgery at cesarean session. This again is Dr. KK. This is Time with a Gynae. Subscribe to the channel. Don't go today without subscribing, and enjoy all the other episodes I've posted. I'll see you again in the next one.